Recently, I had an increase in abdominal pain. I was very concerned about this and went to my doctor. My doctor ordered for me an ultrasound. We discovered that my ovarian cyst has grown and it's now over 6 centimeters in diameter. An ovarian cyst of this size requires surgery, so I've been looking into surgeons. There were 3 surgeons who were on my list of possibilities. I did a lot of research about these surgeons, so let me give you a rundown about these 3 surgeons and let you know which surgeon I decided to go with. The first surgeon is the surgeon I had back in 2022. He is an excellent surgeon. He does a lot of surgeries a year. And when I say a lot, I mean he does approximately 400 to 500 surgeries a year. So he's very trained, very skilled, and he is very familiar with complicated cases. And he just seems to know a lot about endometriosis and how to do this excision surgery. The one thing with this surgeon is that he's not always truthful and forthcoming. We had some minor issues before surgery. We had some other minor issues after surgery with the surgeon not telling us the truth. They were not big issues, but I was very concerned because if he was lying about little things, who knows what he could be lying about. If something major happened, he might try to cover it up, or he just might say, oh, that didn't happen. So I was very concerned about this. Also, after surgery, when I was having an increase in abdominal pain, I was very concerned that maybe the cyst was growing back. He told me, oh, no, no, no. He got all the endometriosis. The cyst is gone. There's no way it's growing back. In the end, it was actually a cyst that had grown back. Either it was the same cyst or there was another cyst that developed. It developed, it ruptured, it caused a lot of pain. And instead of trying to investigate this, the doctor just brushed it off and totally ignored all my complaints. So I'm a little bit leery about ever going back to that doctor, because if he did not like that I had an ovarian cyst after having surgery, I don't think he would like that I have another ovarian cyst and have more endometriosis and need another excision surgery. So I'm not very confident. He also did say that he might, if I ever came back to him, just rip out all my lady parts, which I do not want. And that's very, very scary to me. So although I think the surgeon is great, I'm very, very concerned that if I ever went back to him, he would either not take my concern seriously, say, no, I don't have a cyst. He would take my concern seriously and then just rip out all my ovaries and my uterus and just rip everything out because, hey, who needs those? Or he just wouldn't tell me what he was going to do, and then I'd wake up from surgery and surprise, he took out an ovary or took out both ovaries, or I don't even know. Like, I don't have any guarantees if I go with this doctor what he's going to do, because whatever he says and whatever he does are not the same. He's not congruent with that. So I'm very, very leery about that, and I really don't want to go back to him, even though he has my medical history. He's done surgery on me. And I feel very comfortable with that. I don't feel very comfortable with this surgeon just doing whatever he feels like doing without consenting me. So I don't think I'm going to go with surgeon number 1. So I found another surgeon, surgeon number 2. This surgeon works at a hospital I've not had a good track record with. The hospital just did a lot of things that were very, very bad. They did not properly treat an infection I had. They kept giving me antibiotics, this one antibiotic, which was wrong for that infection. And then when I never got better and I kept getting sick, they kept blaming me for getting sick. It was only until I went to a different hospital and they looked at my sputum culture and they said, why are you taking this antibiotic? It's your bacteria is resistant to it. Your bacteria is never going to get killed off taking this antibiotic. You need to take this other antibiotic. So as soon as I started on the proper antibiotic, I got rid of the infection. And unfortunately, I had spent 2 years basically at that other hospital, in and out of the hospital, because I was so sick, because they never properly treated my infection. With that said, they basically said I was lying about everything and I wasn't really sick and I was just causing all my issues. And it was really disheartening because I really trusted the medical team there. And I was so blind because it was a major medical institute and I was blind because of that. And I was just thinking, well, okay, I guess, maybe I'm telling myself to be sick. I don't know. I started to believe their lies. And it was only thankfully because of 2020. Ah, we love 2020, don't we? So many things happened. I was forced to go to a different hospital, and that hospital was like, what are they doing at this other hospital? It's totally the wrong treatment, and here's the right treatment. And within a month, I was completely better and rid of that infection. So that second surgeon works at this hospital. So I'm very concerned about that hospital. They don't provide very good treatment. They could mess up my medical. I'm not very. I'm not very happy to ever go back to that hospital. The surgeon at that hospital is phenomenal. He comes very highly recommended. He's a very skilled surgeon. People really like him, but I'm just not very confident about that hospital. That hospital was not kind to me, was not good to me, and they did me a lot of harm. So probably doctor number 2, I probably won't go see unless I can't get anything else to happen. Next, I have doctor number 3. Surgeon number 3 is phenomenal. She comes very highly recommended. People love her. They just said how kind she is. I've talked to people that have had surgery with her, and they just said she was very kind, very compassionate. She listens to you. She understands your needs, your concerns, and whatever you say you want to be done, she will follow through. If you say, yes, I just want this ovarian cyst, but please keep all my lady parts. Don't take any of my lady parts. She will say, okay, that's what you want. We will do that. And she follows through with her word. The biggest issue is that doctor is 10 hours away. I know, a little far, but sometimes I feel like good medicine is worth traveling to. So that is a big hiccup right now. That is 10 hours away. Also, I've never been to that hospital. I don't know if they'll be confused, perplexed by my medical issues. I also have found, because this is at a major medical institute, that sometimes they just kind of look at me like, why is everybody so confused? Okay, you have a tracheostomy tube, you have a ventilator, you have a couple medical issues. Please, you're nothing. You're not on dialysis. Please, you're not on this. You're not on that. You're not on this. So sometimes when I go to major medical institutes, they just kind of laugh like, you're really one of our least complicated people. So I'm hoping that being this major medical institute, that maybe they will treat me the same way. Like, I'm not saying that they won't take my concerns seriously, but they just won't be burdened by them. They won't freak out when they see I have a tracheostomy tube and ventilator. They're just like, we'll just add your name to the list. Life of the vent, tracheostomy tube, ventilator. Okay, you're our 327th patient today with a trach and vent. No worries. So I'm hoping that is how it's going to go. So I am trying to get in right now to see the doctor. I actually called up there. She has a pretty fast schedule, which is good. Most doctors are several months, like five months out. They're scheduling. She's actually only scheduling about 6 weeks out, which I was very excited to hear that, because I thought, oh boy, really 6 weeks. But then I asked about surgery, and I said, how far out for surgery she's scheduling? They said, once you get the initial consult, once they decide you need surgery, she will do surgery approximately 3 months after that. That's just how her surgery schedule is. So it's about 4.5 months total from the time you book your initial appointment to surgery, which is actually not bad. There are some doctors that are much, much longer. It takes several months to get in to see them, and then several months more to get surgery. So I'm very happy about this. And I'm also thrilled that she is willing to do a telemedicine visit for all the pre-surgery visits. She said she would do telemedicine. I can do the pre-op exam with my local physician, and then just have everything faxed up there. They'll review it and then submit it on to the hospital. So they're willing to do everything via satellite. So I was just thrilled about that. I was like, oh, this is amazing. I will only have to travel up there to do surgery. They do not seem to be very worried or concerned about this. They said they have people all the time that come in from faraway places to do surgery. So I'm not an anomaly. This is not something new. They're used to doing everything telemedicine, and then just getting everything kind of sorted out the day of surgery, doing surgery, and then following up with telemedicine, following up with my local primary care provider, and going from there. So it looks like I'm going to go with surgeon number 3. I really hope this goes well. It seems very promising. The office was very, very kind to me, very, very nice, answered all my questions, and just seemed very willing to work with me, which seems very promising, because if the office is willing to work with me, that usually means the doctor is also very willing to work with me. So that's the hope. So hopefully 6 weeks will have my first appointment via telemedicine, and I will give you an update once I find out some more. So thank you so much for joining me. Please remember to like and subscribe down below. Please also remember to comment and share. It really helps my YouTube channel. I hope you have a great day and a wonderful week. Bye-bye.